Good afternoon, ladies and gentlemen. Welcome to another episode of myth busting, myth cracking, uh, myth solving, medical myth solving. So today we'll be looking at myths associated with infertility. We have some myths that we are going to bust today that are associated with infertility. These myths include: one, people believe that when they have rigorous sex, that is when they get pregnant. They believe that the more the sex is rigorous, the more chances of you getting pregnant. It is absolutely wrong, absolutely not correct. Pregnancy does not come because of rigorous sex. Pregnancy comes because of what? Frequent sex, irrespective of the duration, irrespective of the force you use in having the sex. What matters is what? You are having regular, penetrative, ejaculatory, orgasmic sex. Once this is established, it is very likely that you will get pregnant. So harder sex does not cause pregnancy. Frequent sex causes pregnancies. Another myth is what? Infertility is purely women issues. This is common. Today it is still common amongst men. Even men that are enlightened believe that the infertility is solely their wife problem. Infertility is never solely a woman's problem. In fact, infertility is caused, 30% of the causes of infertility are found in male, 30% of infertility are found in female, 30% of infertility are found in both male and female, and 10% of infertility is unknown. We don't know what is causing it. We don't know, so we call it idiopathic. 30% in male, 30% in female, 30% from both of them, and 10% from unknown cause. So you can see that infertility is not just the problem of a woman. Infertility is a problem of both the man and the woman. So it is not a reason why you should subject a woman to hardship. It's not a reason why your in-laws, your father, your mother will debase her, humiliate her, call her all sort of name, call her barren and all sort of name because she is not yet pregnant. What of if you are the one that is sterile? What of if you are the one that is sterile? You might even be sterile right from childhood. Nobody knows because you have what we know as mump infection. Mump infection will even cause sterility in male. So infertility is not a sole problem of women. It is problem of man, it is problem of woman. Combination of both. Age. People also believe that infertility solely affects women. Once they are aged, they can no longer get pregnant. As far as they become menopausal, they can no longer get pregnant. Men also, age also affect men. Don't think that because you are 40 years, don't think that the sperm you are producing at 40 years is as healthy as the sperm that you ought to have produced when you were 20 years. In fact, research has shown that the sperm cells you produce at a younger age, below 30 years, they are more healthy than the sperm you produce above 40 years. So age affects both the male and the female. The female undergoes menopause. The male also undergoes climacteric age. They get to a certain age, their hormone level drops, and at the end of the day, when their hormone level drops, their semen count reduces and they find it difficult to impregnate a woman. Yes, the urge to have sex is there. The urge to have sex is there even up to 90 years. Some men still have sex even when they are using walking stick to walk. They use walking stick to move around. They still have sex. They have arthritis of the waist. They are still sexually active. But that doesn't mean that they are 100% fertile. So age also affect them too. Of course, even a postmenopausal woman also have urge to have sex. Okay, so another myth is what? Leakage of semen causes infertility. This is an obvious lie, and for centuries, for years, the herbal guys have used this to deceive people. In fact, I know people that have spent fortune. They spent fortune in this matter until they were advised to go and see a doctor, and the doctor discovered that the problem of the woman is what? Milk discharge from her breast. That is what is causing her problem. He gave her drugs, and within 2 to 3 months she became pregnant. Whereas they've been spending hell of money on these herbal guys who were telling them it is header that is causing your infertility. Header is a scam, a big scam. Is never the cause of your infertility. In fact, leakage of semen from the body is physiological. It has its advantage. Let me explain to you how it has its advantage. Normally, when you ejaculate, when a man ejaculates, the semen is normally thick. It's thick. The sperm cells are embedded inside this semen. They must be released. As soon as this semen comes out, it comes in contact with hair, oxygen and others. What happens? It liquefies. And the sperm immediately starts swimming, moving to where they will fertilize the released eggs. Research has also shown that within 3 to 5 minutes of ejaculation, the sperm cells are already in the ampulla of vata, waiting for release, waiting for the egg that is released. And let me even tell you that sperm cells can stay in the woman uterus for up to 5 days. If you have sex today, the sperms that are even released today can stay inside that body for the next 5 days waiting for the egg. And theoretically, they said that there's a connection in this between why you want to have a male child or why you want to have a female child. Okay, because okay, let me not go into that. Maybe in the next meet we're going to discuss, we may go into that. So take note that this is a scam. That thing they call EDA is a scam. They use it to scam people that are not oriented so that they can make money. Just as they are scamming people with Staphylococcus aureus. Big scam. These herbal guys, scammers. Normally, let me explain why Staphylococcus aureus, a normal human microbiota that will not even cause you any problem except you are immunocompromised. Your immunity has dropped. That is when it will cause you problem. Staphylococcus aureus is found in the skin. Normal. If I take swab of this my skin and culture it will go Staphylococcus aureus. If I culture my pubic region, it will grow Staphylococcus aureus. Now, how are they using it to scam people? You go to the laboratory, you take a swab, maybe endocervical swab or vaginal swab. Sometimes the swab become contaminated from the Staphylococcus aureus that is found in the hair region, the pubic region, and it grows Staphylococcus aureus. And they'll say, you see, it grows Staphylococcus aureus. It will not cause you any problem. Most times when they come with results of Staphylococcus aureus, I just laugh over it. I don't do anything about it. It's never a problem, except the person is The only time I will be worried is either the person is diabetic, or the person is HIV, or the person has any immunocompromised disease. Then I'll be worried. But normal human being that has no problem, there is no cause of alarm. It is not a sexually transmitted infection. It has no basis of treatment. There's no need of you abusing antibiotics because Staphylococcus aureus grows in your agar. Okay, that's that. Another myth that people also think believe in is what? They believe that use of family planning, peas, people that have used peas in for long term, they have infertility. It's not correct. It is totally not correct. It is totally not correct because research has also shown that even women who have been taking oral contraceptive pills or they are on family planning for a long time, when they remove the family planning, they easily get pregnant than even women that have never been on family planning. They get pregnant. And be rest assured that even oral contraceptive pills is used to manage hormonal problem. For example, oral contraceptive pills is used to manage menstrual pains. It is used to manage distorted menstrual cycles. When someone is having menstrual cycle that is distorted, they use oral contraceptive pills to manage it. Oral contraceptive pills has lot of non-contraceptive uses. Okay, then they also believe that women who are above 35 years can never get pregnant. It's not true. Even women that are up to 45 years can get pregnant as far as they are not yet menopausal. They can get pregnant. The only thing is the eggs that they are releasing at that age is not as healthy as the eggs that are being released during when they were younger. So these are the common myths that is associated with infertility, and these myths, as I've explained, has enriched a lot of quacks. This myth has enriched a lot of herbal guys, and so the myth that is enriching these herbal guys have decided to be busting this myth so that they will not be scamming people, especially with Eda. They have scammed. In fact, the southwest so much believe that Eda causes infertility. The questions have, in fact, I have explained more than 100 times, and the people that keep asking these questions are my brothers from the southwest and my sisters from the southwest. They keep asking this question because they be one ever guy want to deceive her and collect money. So that's that for the myth that concerning infertility. Now, what are the cause of infertility? What are the cause of infertility? Now, we have seen these myths that they are not correct, they don't cause infertility. Now, what are the causes of infertility? What are the causes? We have infertility in male. We have infertility in females. We have uterine factors, the womb. There are some factors that are associated with the womb that will make a woman not get pregnant. What are these factors? 1, uterine fibroid. Fibroid. If a woman has fibroid that is symptomatic, there is high tendency that she will not get pregnant. However, sometimes they have asymptomatic fibroid that are only discovered incidentally. Probably they ask them to go and do ultrasound scan and they find the fibroid. No cause for alarm, they will get pregnant. But the truth of the matter is that fibroid may likely grow and grow and grow and become symptomatic. 1, uterine fibroid can cause infertility in females. Another uterine factor that can cause infertility in female is endometriosis. When we say endometriosis, during menstruation, the woman will have endometrial cells Endometrium is like the lining of the uterus, the lining of the womb. It is what is shed during menses. The endometrium is shed during menses and it is replaced. You have new ones, just like a cycle. So sometimes these tissues, these endometrium tissues, are found in other parts of the body, like the lungs, like the nose, like the eyes. When the woman is menstruating, she start crying blood. You see, blood will start running out from her eyes because the endometrium in the eyes are also bleeding. She have the most severe one, endometrium in the lungs. She will be bleeding inside her lungs. So this can cause infertility in the female. Adenomyosis. Adenomyosis is just like fibroid, although it is more severe than fibroid. Most times they remove the womb and the adenomyosis together. Another cause of infertility in female include what we call uterine synecdoche or Ashaman Syndrome. How is it? Why? Those people who continue to do abortions, they continue to do abortion, they go to a nearby chemist and they do D and C for them, overzealous D and C for them. They end up with, in fact, the local man will completely remove the endometrium from them. Will finish everything, finish the endometria for them, and what now happen? It will now be scar. The walls of the uterus will join together and cause what? Scar. And she can no longer get pregnant. She'll have she may not even be seeing her period anymore because no endometrium is finished. You don't have any endometrium there, so how will you see your period? Estrogen and all those other hormones have nowhere to add, so you will not bleed, you will not see your period. Though it is treatable, though expensive. Okay. Another risk factor for infertility in women, in fact, the most commonest cause of infertility in women is what? Infections, PID, pelvic inflammatory disease, is the most common cause of infertility in women. How? Some of these women, they cannot negotiate for condoms. You say you trust your boyfriend, you so much trust him, he's my fiancé, I want to get married to him. You keep having unprotected sex because he wants to get married to you. You don't know that your fiancé, your Prince Charming, has 10 side chick somewhere that also trust him. He's not using condoms. He picks all these diseases and dump them in you. And you may not even become symptomatic because you are now used to the diseases. It becomes asymptomatic. What now happens is this infection will cause scarring in the fallopian tubes. To cause scarring in the fallopian tubes, sometimes it becomes acute PID. They become inflamed and you will become seriously sick. Sometimes it is chronic. You will not even feel anything. But when it is time for you to get pregnant, then you will understand what is going on. You cannot get pregnant because the uterus, the fallopian tubes, they are scarred, they are inflamed. If you keep trying without treatment, what will happen is what? Ectopic pregnancy. Because of scarring, the fertilized egg will not be able to go to the uterus to implant. Rather, they will do what? Implant in the uterine tube and the fallopian tube, and it will cause ectopic pregnancy. This is the commonest cause of infertility in female in our environment. Edo State, in fact, all over Nigeria, the commonest cause of infertility is this, followed by what? Hormonal imbalance. Hormones. Some persons have polycystic ovarian syndrome, very common cause of infertility. Their ovaries become cystic. Some persons, they have hypothyroidism, they become infertile. Some persons, they have hyperprolactinemia, galacturia. When they express their breast, they discharge milk. This is also causes of infertility in female. In fact, the more severe infertility, you see the lady will start having what? Headaches, unexplained headaches, blurring visions. If diagnosis is missed, instead of prompt diagnosis, they will go and see an ophthalmologist because of the blurring vision. They will give them glasses. Still, the headache, they'll say it is because of her eyes. She's having a high problem. That's what is causing her headache. They'll give her glasses. The headache will still be there. She will be discharging breast milk. She will be feeling headache. She will be having blurring eyes. Until they will go and do a CT scan, they will discover that she's having what? Pituitary adenoma. The pituitary is enlarged. The pituitary gland is enlarged. Is crushing on the optic chiasma, causing blurring visions. And this is the reason why she's having milk discharge from her nipples, and hence infertility. Another cause of infertility in women is what? Cervical incompetence. Cervical incompetence, the cervix can no longer hold, the cervix is loose. They have persistent miscarriages. The person may have first miscarriage in 2 months. They will think, it's just miscarriage, normal. She'll get pregnant again. At 3 months, she'll have miscarriage. At 4 months, she'll have miscarriage. That's how it will progress until they'll make diagnosis that this is what? Cervical incompetence. If the person that this is happening to is not oriented, and maybe he has a co-wife, he will accuse the co-wife or the mother-in-law or one of her auntie or one old woman in the village that the old woman is the one eating the child in her womb. That is why she is having miscarriages. So this is just a preamble of infertility in women. Now, what are the causes of infertility in male? Still, infection. Some male are infected. They have the infection has affected their epididymis. It has affected their cellular. In fact, it has affected those places that produce sperm cells. Some have prostatitis that is not well treated, and they will come down with infertility. Some are abusing medications, tramadol, and other drugs like cimetidine. These will also cause infertility in male, though it can be resolved. Varicocele, large veins on the scrotum. Varicocele, when you touch them, they feel like bag of worms. This kills the sperms because of what? The heat that blood carries. And this can also result to infertility in male. Hormonal problems, reduced testosterone. This can also cause infertility in male. Now, some male, when they have infertility, the first thing they do is they push their wife to the hospital. They think that the problem is from their wife. No. In fact, the first person that needs to be screened of infertility is the male, because screening of the male is not invasive, it's not painful, it's not expensive. You could just see the problem in the male. Just semen analysis can give you a picture of what is happening. They will do semen analysis, then they will do what? Microscopic culture and sensitivity of the semen to see if any microorganism like gonorrhea, chlamydia, and what have you will grow in the semen. If it grows, then this is the problem. They will take a look at the sperm with microscope and count the cells. If the cells they will look at the color, they They'll look at the volume, they'll look at the smell. All these are factors that will be factored into it, and if any of these factors is not up to the recommended ranges, then it will be classified that the infertility is from the male. For the woman, they will do ultrasound scan for her to be sure that she's not having fibroid. They will do hormonal profile for her. They will do they will do what we know as HVS, high vaginal swab, endocervical swab for her to rule out infections. Then if they will do what we know as HSG for her to be sure that the tubes are not blocked, to be sure that she's not having uterine synechia. They will do they will do hormonal profile. I've said that before. So these are just preamble of just the surface of what can cause infertility. If this is followed, 90% of infertility cases will be solved. 90% of infertility cases will be solved just from what? Adequate history. History taking, the doctor will ask you questions upon questions. They will even ask you down to how many times you have sex. Some persons, they have sex once in a month and they want to get pregnant. How? Once in a month and you want to get pregnant. How? They said they know when they ovulate, and that is when they target. How do you know? You know when you ovulate. Normally, a woman should have sex at least 3 times a week. This sex should be what? Penetrative, ejaculatory. The man must ejaculate inside her. This is when pregnancy can occur, at least 3 times a week. You want to get pregnant, your man is in Kano, you are in Edo State, and you want to get pregnant. You only have sex once in a month. How is it possible? It's not possible. Except God helps you, you hammer, and you just luckily have sex exactly when the eggs is released. Regular sex is important in infertility problem. Regular sex is important in infertility problem. Another cause of infertility, before I forget, Kayamata people, steaming vagina people, unipels people, and so on and so forth. Some women, what they do is they put steam. Some even push burning charcoal and whatsoever in their vagina. I don't know why they are putting those nonsense in their vagina. They want a very tight vagina. For what? You are feeling pains. You are passing through pains just because you want to please one man. A man that can divorce, these days that divorce is so common. A man that can divorce you at any time. You want to tighten the vagina for him, causing yourself pain. It has been found that vaginal atresia can cause, or even vaginismus can cause infertility. The vagina becomes smaller, scarring, and painful because you have decided to be putting things as if the vagina is a cupboard to keep things. You are putting things in there. It can cause infertility. Apart from the fact that you are putting things in there, you can wake up some bad infections that will kill you. So, issue of putting kayamata and all those nonsense in your vagina, you need to stop it. It can cause infertility. If you have a extra wide vagina, maybe normally it is normal Just as we have different sizes of penis, that is the same way we have different sizes of vagina. No woman should be ashamed about it. The only time you have problem is probably you during your delivery. You had vaginal injury, perineal tears, and it was not repaired, and this will cause more problems. Yes, this one we understand, but naturally every woman has different. In fact, vagina comes in different sizes, just as we have different sizes of penis. That's the same way we have different sizes of vagina. So there is no point of you trying to please one man that has a pencil-sized dick. Because he has a pencil-sized dick, he cannot feel your vagina. Then you decide to want to cause vaginal atresia by putting charcoal, putting kaya manta or whatsoever, and steaming the vagina so that it become what? Tighten, causing yourself problem. So I'm going to round up here for today. If you have any question, I know this topic will breed lots of questions. If you have any questions, you can drop them in my inbox, or you can drop them in my emails. I will adequately respond to your questions. Thank you for your attention. Until we meet again in our next episode Busting the Myths, I remain Dr. Abdul Salam. Thank you so much. Bye.